Welcome to Yoga Framework. My name is Jeffrey, and in this video, we're going to explain PAILS and RAILS for internal hip rotation. Let's begin seated in the 90-90 position. And basically what that means is each knee is in a 90-degree angle, or the best that you can make that. You could always lift the front knee if that's an issue, especially when dealing with the back leg. In another video where we talked about hip external rotation, we were more here, but for internal rotation, we're gonna wanna be more towards this back leg. I like to think that the femur, which is the biggest bone in your body here, is being pulled down to the floor. And if you need to lift that leg to make that happen, that's okay. You could even reduce this a little bit if necessary. Like I said, the focus is the back hip. This is internal rotation. This is the 2-minute stretch. Let's begin it now. I like to think of this like the other half of pigeon pose, right? So as you internally rotate your hip, you're not doing the opposite of pigeon, you're doing the other half, right? Because you don't want to have half of a hip. And if you think about yoga, you end up just practicing external hip rotation like crazy, but you don't really practice the internal. So if you have any kind of pulling in your knee, you should laterally move away from that, right? You can lateralize the body like this. You move away from the tension. But if not, you can come up. You could take this leg down if you want, right? You should be feeling something in this back leg, like say between here, the knee and the ankle. You don't want to feel it going into your knee or pulling the kneecap, and you don't want to feel it creeping up into your hip. Ways to move away from that: lift the front knee, concentrate on the back, the femur, lateralize away from the position. When in doubt, lateralize. You have about 45 seconds left. I'm doing the full 2 minutes. We're not speeding it up. You need to stay in the 2 minutes. Unfortunately, stretching is boring. I hate to break it to you. You can't rush it. That's how you get injured. People are constantly saying, I go to yoga all the time and I'm tight. And that's because they're forcing stretches and the body is getting injured in these ranges, and it gets tight when it's injured because it doesn't like to move. And then they force it again, and eventually you get injured. So we're not forcing anything. If anything, we're backing off. So we're approaching the 2-minute mark right here. And I'm not even gonna take my front knee down. I could even take a block underneath this to support it if I wanted to relax, but I'm okay with it lifted. You can do as you please. What we're gonna do now is, while the hip's internally rotated, we're gonna add the PAIL, the progressive angular isometric load. So we're gonna push into the floor, right? The long tissue is now on the bottom, as opposed to with external rotation, the long tissue would be more here. This is now the short tissue. Push down progressively into the floor. Right, 5 to 10 seconds. And we're not gonna lift the leg, but we're gonna try to pull ourselves towards that back leg as if we were lifting it. It might seem impossible. Think about closing this angle right here in the body. So rail contraction. And see how I'm kind of pulling myself. Now, I'm not using my hands. I'm just showing you I could lift my hands. I'm not saying do that though. Just don't support yourself with the hands. Pull this together, right? Contract the tissue here. And then once you're at that rails contraction at the end, you stay there. You can support yourself now. You're just not gonna let yourself move away from that unless there's pain, right? If your knee is gonna pull and you're afraid, obviously you went too far, you can lateralize away or adjust, always within your range. You know, I don't know your body, you know your body. Right, so back to where I was pretty much at my edge, starting the PAILS contraction, push again, right? So now I still have this closed angle, or it was more closed than before, and I begin the process pushing down like there's a scale underneath my leg. PAILS contraction down. 5 more seconds. 4, 3, 2, and then rails contraction. You know, try to pull it together. It's almost like you're standing up or sitting up straight, trying to contract this tissue over here. Right? And maybe you can even lift the hands and you're creating more of that, and that's fine. And then the last one, you push to the floor. I like to use the hands for the push, the PAILS. Right? It creates more tension for me. Just don't let the hips lift. PAILS contraction down. But for the last rails contraction, now that I feel more room, you know, I might lift and try to control that better, right? Contracting this tissue, right, all along here, pulling it together, internal hip rotation. A few more moments, try to hold. Regressive tissue, angular, isometric, load. And then slowly, let's come out of this. All right, you're going to lateralize a little bit to move. If your knee feels a little janky, you could always give it a little rotation, tibial rotation. Check out the knee car video if you're not sure what I mean. That's in the cars playlist. And let's switch to the other side. Okay, regressions, right? If you're having a hard time finding this, you could bend the front knee, like I said. You can lift the front knee as well. Whatever one's better for you. You're trying to find this internal hip rotation. Look for the 90-degree angle here. And we'll begin the new timer. So around 2 minutes, more, could be less. I would always try to go more. You don't want to force a stretch. Remember, if you force a stretch, it's kind of like you're weightlifting at an end range. Your body doesn't like that, and it tends to be tight. When you get to end ranges, your body wants you to move slow and controlled. And being that you're so ready for action, dynamic systems theory, you need the 2 minutes for your muscles to actually understand you're in a stretch. Kind of like when you eat, it takes time for your body to understand that it ate something and to feel that reaction. All right, you're almost at the minute mark. As you can see on this side, right, my knee is already lower. I have more room here for some reason. The way I'm living, I need to work on the other side a little more. And I'm constantly adjusting as well. So I'm constantly trying to find more tension, right, in this area. This is the internal hip rotation. Think of it like the other side of pigeon, right? You always externally rotate this one. We do this all the time, but we don't really do this so much, and that's why it's so important. It's also a different sensation. It's a lot harder to force this. You're not as strong as you are here. You have about 30 seconds left. Less is more. You can always lift the knee more. Lateralize, right? When in doubt, lateralize away from the pain, the tension, whatever is there. You want to make sure that you're in control and not overdoing it. So we're just about at that 2 minute mark. And now what we're going to do is we're going to start that PAILS contraction. Push down with the leg. So right, that whole knee here, driving that into the floor. And create the tension. You should feel the leg kind of lighting up. You should feel this tissue working more. And then the rails contraction. You're going to pull this tissue together. Right? Contract it on the short side. Right? And maybe you find a better position here. You're a little straighter. You're going to stay here and try to relax for a moment. If you're freaking out in the back hip, that's normal. Cramps are like an epiphany in your body. A spasm is like your body's freaking out. It's a little more intense. PAILS contraction, push, right? Push down with the leg. Drive the entire leg into the floor. Imagine there's a scale under it. Ramp it up, right? Progressively ramp it up. Progressive. All right, when you're ready, rails contraction. Pull it together. All right, so at this point, I'm able to almost lift my hands. All right, and I'm contracting this tissue over here. I'm pulling this together to create the rails contraction. The PAILS is on the inside. I'm going to take my hands down again, not reducing the position at all, but driving PAILS contraction. Again, internal hip rotation, ramping this up. Progressive, tissue, angular, isometric, load. And then rails contraction, I'm gonna pull it together, right? I'm not pushing my knee, I'm pulling this tissue in here, trying to pull it together, trying to sit up straight. Keep that going for 5, 4, 3, 2, 1, and then you're gonna support yourself without losing the position. Time under tension, this is the last part of it. You probably wanna come out of this. That's a sign that you've been doing it right. A little bit longer. Obviously, if you're dying, come out of it. Let's slowly unravel. You can help your leg with the hand. Maybe give the knee a little tibial rotation here, where this bone is rotating. Again, check out the knee car video if you're not sure what I'm talking about. And I hope that was somewhat of relief for the hips. You can incorporate this into your normal routine 2 to 3 times a week to help you gain power control in those hips. I would work on ramping it up with more tension and possibly more ways to increase weight. I'm Jeffrey, this is Yoga Framework, and every week I teach you how to create a better yoga and mobility practice. Thanks for watching.